Thanks for staying with us. So on Tuesdays, we talk about health. Joining us on the show is the Lagos State Commissioner for Health, Professor Akin Abayomi. He'll be speaking on the state of health in Lagos healthcare system in the last 3 years of the Governor Babajide Sanwo-Olu's administration. Welcome, sir, to the show. It's a pleasure to have you.
Morning.
Before we start our lamentations, because we have a lot of them, let me give you the floor to tell us some of the things you've done, especially with the Lagos State teaching hospitals, as regards equipment, staff, remodeling. What have you done so far? Give us a nutshell before we start telling you some of the issues and the updates on coronavirus. Yes.
You still want to hear about Koro?
No, not really. Let's start with the hospitals, especially the Lagos teaching hospitals.
Okay, so I think when every government comes into their current dispensation, the first thing to do is to look at the landscape and to assess what's going on and then define a strategy moving forward. So we did quite a bit of work on that just before Corona came in. And even during the first phase of Corona, we're not totally distracted by Corona. So we had an opportunity to examine what the health-seeking behavior of Lagosians is or was, and what the trend is. And what we found was that, there's a tremendous utilization of what we would call grassroots health systems, like traditional medicine and herbalists and street vendors and pharmacies. We then looked at what we currently offer Lagosians in terms of health. And remember, we are the Ministry of Health, so we're the Ministry of Health for Health of Lagos State, which includes both public and private. We found that the infrastructure of the health system in the public sector was extremely deficient in terms of standards. We also realized that we were not using enough data, health data, and there was very little research going on in Lagos State. The other thing we discovered was that the public-private partnership really was very weak, and that the private sector was proceeding along its own path, and the public sector was going in another path. Yes, our job as government is to form a synergy between the two, because 70% of Lagosians are seeking their health in the private sector, or even in the traditional African health systems. So there was a lot of work we had to do. Then we looked at what the human resources for health, what the state of the human resources for health was, and there's a lot of low morale in the health sector, the health professionals, with the typical expression that you've all heard, brain drain. So we tried to understand what are the catalysts and the accelerators of brain drain. And then, very importantly, health financing. So how do we pay for health in Lagos? So as a government, let's keep it very high level. What does government do? Government sets policy. Government ensures that we can implement and regulate those policies. Government sets a standard and a benchmark. Government is very important in terms of a public protector and creating social safety nets. And then possibly finally, you want to create an enabling environment for the private sector, which is the majority sector that is driving health delivery to your citizens. So we looked at all that and we went back to the drawing board and we started to design a strategy moving forward.
Okay, so let's start with the private sector, because the teaching hospitals will come back to that. We found that it seems that many of these private hospitals are not properly regulated. Many of them have dilapidated facilities. Many of them are not well equipped in the sense that they don't have everything within one hospital. So you have a condition, and they refer you to another hospital to do something else, to get one test here, you're going to do one thing there, and come back, it's just so hectic for us.
Yes.
What are you doing to regulate, to ensure that if we enter a private hospital in Lagos State, it has quite enough resources to accommodate Nigerians and all the basic needs that is required of them.
Yes, so that goes back to policy and regulation. So we have what we call the Health Sector Reform Law, which includes HEFAMA, which is the regulator of health in Lagos State. And HEFAMA goes out with a standard. So if HEFAMA, for example, is going to a IVF clinic or a fertility clinic, they go with a team of experts that form a subcommittee that advises HEFAMA on what to look for inside a specialty unit. If they're going to an orthopedic facility or a plastic surgery, they're going informed, with experts forming a subcommittee behind them to look for what they actually need when they get there. All right, so of course, majority of health facilities are not specialists. So majority are either family practitioners or just general surgery or general medical facilities. Now, there are at least 4,000 private sector facilities that we know of, compared to only about 400 government facilities. So there's a 10-to-1 ratio, right? And there are umpteen traditional medicine or alternative medicine or ancient medicine or cultural medicine practitioners in the state. So what we've done is we've really emboldened our traditional medicine board. When we came into this dispensation, there was no board. There was just a building, so we've set up the traditional medicine board because we want to seriously understand what Lagosians are doing when they go to these health traditional sector. We want to regulate it. We want to bring them in. We want to make sure that, as you know, what we say in medicine is at least do no harm. If you can't do anything, if you can't do good, don't do any harm. So that's important, and that's what regulation does. We go out there to make sure that health practitioners are not causing harm, whether they are in the conventional system or they're in the alternative system. We need to be able to regulate that entire sector.
Yeah, I'm happy to hear about the traditional medicine, but because I know how doctors feel about traditional medicine healers, they don't believe in them really, and do you, and I know you're a doctor, how do you feel? Do you feel that they can actually heal?
So when we talk about alternative medicine, we're talking about a whole spectrum of things. We're talking about herbalists, acupuncturists, aromatherapists, traditional birth attendants, bone setters, psychologists, people that give counseling, divinators, and all that kind of thing. But, it's there. Let's not fool ourselves that our people are not seeking health in this sector, So it's very important that we understand what that sector is and that we regulate it and that we even, so for example, malaria. Africa experienced chloroquine resistance. In other words, all the malaria we get in Africa, the drug we were using was chloroquine. And after a while, about 15 years ago, chloroquine stopped working. And thousands and millions of children were dying from chloroquine-resistant malaria. But guess what? There's a herbal plant in China called artemisinin. And we discovered that artemisinin can overcome the resistance of chloroquine malaria failure. So that is a herbalist plant. It's used in China for centuries. So yes, it works. We know that there are things out there that are useful. We know that a lot of penicillin came from the ecosystem. A herbalist, somebody discovered it in the laboratory, that when you have a mold growing in a plate, the bacteria die. So wow, there's something in here that's killing bacteria. That came from the environment. So our traditional ancient systems are not ignorant. They're very deep. If you go to China or India, you walk into a hospital and you'll find an alternative medicine practitioner operating right next to a conventional medicine practitioner, and sometimes they exchange ideas. So, yes, your point is, that as doctors we're a little bit snobbish of this sector. I argue with you because we're trained in one way and we think that our way is obviously
the best.
This evidence-based best. But what we're trying to do with the traditional board is understand them, make them safe, and you can also make traditional medicine evidence-based as well.
Yeah. So I want to understand or help us understand the solutions that you've come up with concerning the brain drain. That's one.
Right.
And secondly, a lot of reasons why most people don't like to do the general hospitals is because it's very hectic. So if you need something in this department, you have to go down to the other department and start the queue all over again. Whereas there could be a system where your file is just sent in to that other place since you're still going to come back here. So it's, you just see people going round and round and round. And I think about a few weeks ago, somebody was missing in a specialist hospital because he left to go and get drugs for the mom. And by the time he came, the mom had disappeared. And nobody there could say where this woman went. The woman was supposed to be in their care. What is, what's the solution?
So you've asked about 5 questions, Obi, but they're all connected. So Mr. Governor, for example, understands the very dilapidated state of our medical infrastructure. So he gave me the mandate to develop what we call the blueprint for medical infrastructure transformation. So what we typically have is our general hospitals and our primary healthcare facilities are reconverted buildings. So they're barracks, schools, offices. And, you know, you don't practice modern medicine in a facility that's not designed for its function. So we've gone back to the drawing board. We're designing blueprints for primary, secondary, and specialist, right, including traditional medicine. So all that's been designed at the moment. We're done. We're building our first blueprint general hospital, which is the new Massey Street. We're going to roll out one at Ojo, one in Ibejuleki, and one at Shomolu, different sizes. Then for the primary healthcare, we've developed 3 prototypes, the very large flagship, the primary healthcare center, and the healthcare post. All very modern, attention to energy, attention to movement of patients, attention to movement of staff, natural cooling. They're all 50% low carbon because we all know that the price of energy is rising.
That's interesting. So you're going to pull down the current structures and rebuild that, and how long will that take?
Yeah, so where there's a space to put a brand new building, you know, because there's still a shortage, we will put in the new prototypes. Okay? Where we have an existing building, well, it's too expensive to just pull it down and build. We'll try and refurbish it, but there are some that are so bad that, you know, it's not worth putting the money into refurbishing. Then we'll just earmark that for demolition and put in a brand new.
Where will you find the doctors for all these hospitals?
Let me go on a break. When we come back, I'll let you answer that question. Stay with us. We'll be right back.
Sorry, I didn't.
Stay tuned. Your View will be right back.
Thanks for staying with us. We still have the Commissioner for Health in the building, and I know before the break we discussed the brain drain, and YK had connected it to the fact that even when you build these new structures, how do you get the people to work in this, especially when they are traveling abroad?
Okay, so brain drain is a interesting phenomenon. So you have what we call the push and the pull factor. So in Nigeria, we have to take responsibility for the push factor. What are we doing to our health personnel that is encouraging them to leave the country? You know, and then there's the pull factor, which is the grass is always greener on the other side of the fence. Europe, America, their systems are well organized. They have this, that, and the other. They have light, you know, they have water, they have digital platforms, they have training programs. So yes, you know, I can't do anything about the pull factor. All I can do in Nigeria is minimize the push factor. So we look at brain drain and we say, okay, let's examine it. There's a lot of movement of medical personnel inside Nigeria. A lot of them are coming to Lagos to try for the last time to make something happen before they then leave Lagos for wherever.
Abroad.
So what we've discovered is when we put out adverts for doctors and nurses, we're overwhelmed with applications. And in fact, a lot of medical personnel are unemployed in Lagos. So there isn't actually a physical brain shortage in Lagos State. I can't speak for the rest of Nigeria because a lot of these doctors have come into Lagos. So there is a internal brain drain, and then there's the external brain drain where they use Lagos as the springboard to go abroad.
Let me just quickly counter that a little bit, because I'm a customer.
Yes.
I used to be a customer of General Hospital. If I still have any medical emergency, I'd rather go to the public hospitals. And I interact with a lot of the doctors, and I will tell you that when they go, we might have a lot of non-employed doctors, and I mentioned that during the break because I have the data that I have a lot of correspondents that tell me that, but we don't replace them at a quick rate.
Yes.
So when someone has moved out, it might take months before the person gets replaced. So you might see a department where there were like 6 people, and now there are 2 people doing the work of 6, and they say, oh, we've passed the memo, we're waiting for them to recruit. Or they say that the government will do the recruitment, but the workload on those 2, huge, which reduces their own capacity to perform optimally.
Yes. So that was a thing that we've resolved. So it's called exit replacement. So there are 2 ways of engaging medical personnel. So there's new applications. So we always want to continue to increase the number of health cadres in the system. Then there's you're in the system and you leave for whatever reason, so we need to replace you immediately. So there are 2 recruitment processes that go on, and we've resolved the exit replacement delay problem. Mr. Governor made sure that as soon as there's a batch of doctors that have left or nurses, that we can replace them without his approval.
Okay.
You know, so that's automatic now. So that has resolved that problem.
Okay.
And it addresses the morale of the health professionals when what happens, what you just described, happens. So what we've been doing is we've been increasing the morale of the medical personnel, first of all, by employing more. Secondly, by rapid exit replacement, by improving their packages, welfare packages. And as you know, the doctors and the nurses all went on some union activity, which were able to meet with them, feel the empathy that they were exhibiting and expressing, and Mr. Governor was very generous, understood what the issues are, and he met almost 100% of their needs.
Okay, so one of the core grounds that I have is when we list our achievements, Lagos is more than Ikeja, VI, you know, like there is a lot of parts in Lagos that is highly uncaptured. We have the riverine areas where you need to take a boat to get there, and we have mothers that are pregnant and have to take a boat to get to proper hospitals if there's a medical emergency that requires more than what the traditional birth attendants can give. We have hospitals across rivers that are not kitted with doctors. They have maybe a few nurses. What are you doing to reach out to those areas, because they are also in Lagos?
Yeah. So I still need to address the brain drain issue, but I'll come back to it because you've thrown another question at me now. So a third of Lagos is hard to reach, either because it's remote or it's water access limitations. So we have a special project now called, you know, the Riverine Access Program. We've ordered water ambulances. They're being constructed right now, so that, you know, we can also access these areas with medical personnel and bring people from these areas who are having emergencies. So in keeping with the blueprint, I told you we have 3 models. We have the large, intermediate, and small primary healthcare facility. So really, the backbone of medicine is at the primary healthcare level. 80% of people will present for primary healthcare. Okay, 10–15% will be referred upwards because what they have, they can't be dealt with at the primary healthcare level. So we are pouring a lot of resources into primary healthcare. We want to put 1 PHC in at least every ward, whether it's riverine, whether it's waterlogged or whatever, and at least have people there posted. And we're going to, you know, devise a strategy where they get hardship allowance because they are moving in and out of very remote areas. And in fact, sometimes it's even dangerous, you know. So we are addressing this access to very difficult terrains in Lagos. People often forget that Lagos is not just island and mainland, and that there are areas of Lagos that are quite remote and quite difficult to access.
Okay, so for me, I always look at the sort of trainings this healthcare professional, especially the nurses, the sort of trainings that they have. And one of the reasons some people don't want to go to the public hospitals is because of how they are treated. You know, some nurses will talk to you anyhow, insult you, raise their voices, like, hey, I'm here for you to give me your service, and then you talk to me like I am a nobody. What are you doing? Well, what is that sort of training that you're giving them to understand that they are there to give us that care, that service, to enable them give that service appropriately? And how have you ensured that their welfare also is encouraging them to give that service that they are working for?
Okay, so I think it's a very complicated issue. You know, what I've just described about improving the morale of the medical personnel is part of it.
Okay.
If the environment in which they work is hospitable, if they have equipment, if they have good packages, if they've got job satisfaction, you know, their morale is boosted. You know, if they're trained properly, then they have the confidence to do what they need to do. So when there are so few of you dealing with hundreds and thousands of patients, you know, you get fatigued. Nobody ever comes into a hospital to give you good news. They come in to give you bad news, you know, and the news can often be very bad. So you have to think about what the psychology of the medical professionals are. So, for example, in COVID, after the third wave, we noticed that the COVID response team were almost, they developed a stone mentality, a stone psychology. I mean, naturally, you see people coming in, breathing, gasping for their lives, many of them dying. You see death morning, afternoon, and night. You know, you almost become like a robot, you know. And we noticed that in the end of the third wave. And before the fourth wave came in, we put together a very detailed program to look at the psychology of the COVID-19 first responders. And a lot of information came out of that. You know, we developed that with several sister ministries in government, Ministry of Estab, Ministry of Training and Health. And we brought in consultants to do a deep dive as to what was going on in the psychology of our medical professionals. And a lot of that came out that, you know, we need to start paying attention to the mental health and the psychology of caregivers, because caregivers are working, you know, not just with a day-to-day routine. They're dealing with a lot of empathetic situations. They're dealing with a lot of issues. They're dealing with a lot of emotions. They're dealing with death, sickness. So we're working on improving that, improving numbers, environment, training, mental support. And things are improving, we're getting fewer and fewer complaints. Right. You know, honestly, I get some really amazing compliments now in the public sector about how professional our doctors, nurses. Right. Yeah. So I think there's a positive move in the medical environment.
So there are Nigerians, doctors abroad,
watching
you right now, and they're saying, listen, I've lived in America, in London, Canada for 10, 15 years, 20 years. I want to come back home. I want to support the services in like Lagos State. What is on ground for me to come and support? Many of them want to move back home. They want to be like you, live abroad. And I feel like, listen, I can do more here. Yes. I've made enough money. Is there some kind of an enabling environment that you're creating for those who want to partner with Lagos State from abroad?
So this is the other side, or this is the flip of the brain drain question. So we now have what we call a brain gain. All right, okay. So we make doctors and nurses and other medical allied professionals. They work in Nigeria, they do NYSC, they spend a bit of time, and the pull is too much. So they leave. Okay, so we feel that we've lost a brain, all right? And we have for a while. But I don't think that there are any Nigerians who want to live perpetually outside of Nigeria. There might be a few. But by and large, most Nigerians want to operate at home. And they'll be out there, they're unhappy, they're saying, I want to come home, but there's nothing to come home to. You know, every time I've tried to come home, it just didn't work, and I just go back to where life is easier. So what we are doing in Lagos is to accelerate this brain gain strategy.
Okay.
So the government, in collaboration with the private sector, we're now diversifying specialist care in Lagos. So it's going to do two things. It's going to reverse the medical tourism out of Nigeria, and it's going to create these modern specialist units where doctors in the diaspora now, and we're specifically targeting doctors in the diaspora, to come back to Lagos where we're providing these ultra-modern facilities where they, so example, we're building a smart short-stay surgery in Lagos Island General Hospital, right on Marina. We're building a comprehensive oncology or cancer center in Lagos. We're doing the Infectious Disease Research Institute. We're building a 500-bed psychiatric hospital in Ketu. 500-bed is the biggest.
I think in Lagos we need at least
7,000.
Yes, right. No, but we have to start somewhere. There isn't anything at the moment. So, you know, there'll be psychiatrists out there saying, wow, 500-bed psychiatric hospital, yes, you know, I want to be part of that. They'll come home. Infectious Disease Research Institute, we never want to be in a situation where Ebola or COVID or Lassa breaks our economy again. You know, we managed to hold the Lagos state economy together. Business was moving even during our 4 waves, and that was Mr. Governor's mandate. Commissioner of Health, keep the economy open, and that's what we did, you know. And so
you did well during COVID, Chan.
Yes,
we must
I think
give that
so.
to you.
Yes, absolutely.
thank you very much.
Very well. Let me go on a quick break. When we come back, we continue this conversation. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So before the break, Toko had a question.
Yes, so I wanted to ask you about the health, because we talk about health basically focusing on the giving of the health services in the hospitals, but it covers more than that, because there's preventive medicine. We need to ensure that we get more information to citizens within Lagos State to avoid them having health conditions that will bring them into the hospital. There's the research and development perspective, where we are beneficiaries of the research done by Chinese in providing artemisinin, and we might probably have, well, reading research about bitter leaf from Oyinbos, and we have bitter leaf here. So what is Lagos State government doing to create that? I don't expect the government should be doing business, but having that welcoming hands towards the health sector to provide enabling environment for that partnership to support research and then the part of preventive medicine with information being put out.
So this is a really important area, and it's what we call, and it's a major strategy of Mr. Sanwo-Olu's government. It's called the One Health paradigm. So if you look at the themes agenda, you see that health and environment as pillar number 2. And in fact, as Mr. Governor was defining his manifesto for this dispensation, it's quite amazing. He didn't know COVID was coming. But you can see it's the visionary leadership intuition that put health and environment together. And that's a World Health paradigm. It says you need to look after health in a holistic way. And you know, you can't say, I'm a healthy human being living in an unhealthy environment.
Cannot work.
Or I'm a healthy human being eating unhealthy food. It doesn't work. You are as healthy as the food you eat and the environment in which you live in. So if you're breathing in bad air, if you're drinking bad water, if you're stressed by getting from your house to work and back, you know, you're driving through fumes, lots of noise, there's noise pollution. So the One Health paradigm is looking, and if you go back to Europe, for example, when there were cholera outbreaks all over the place, what did they do? They fixed the water system. They fixed the rivers. They fixed the electricity, you know. So if you start paying attention to the environment, you know, then you get less people coming in with dysentery, fewer people coming in with malaria, fewer people coming in with hypertension. People are eating better, so they won't get diabetes. So prevention is absolutely big return on investment.
Yes.
You know, and that's what the One Health paradigm is doing. So the One Health paradigm brings Ministry of Health, Ministry of Environment, Ministry of Agric, Ministry of Physical Planning, and Ministry of Justice together.
Brainstorm
But add Ministry of Transport because of the go slow.
Oh gosh, YK.
That's causes stress, yes.
Well, so the go slow is caused by physical planning, you know. So if you build satellite cities and if you plan Lagos well, then the transport system, and of course the transport system is creating multiple opportunities. My colleague is working very hard on multiple transport medium, and you can hear Mr. Governor talking about the blue and the red line and creating water transportation and things like that. So holistically, we're looking at making Lagos a more comfortable place, less toxic, the environment.
Let me ask you something that is outside health, you know, because when we hear commissioners from Governor Sanwo-Olu come on this table and we just listen to them and you just like, they know how to talk, and then he's going to go and pick you from. So when you have meetings, what are your meetings like? What is like? What kind of things do you understand each other's language? I mean, are there politicians amongst you, or do you all sound like you?
No. So when we meet, we talk about, you know, what, for example, would Morayo
sarcasm.
That was good. That's why you got it back. Morayo is the queen of sarcasm. She
Okay, but I'm glad.
But cabinet is made up of all kinds of people.
Yeah.
There are technocrats, there are politicians, there are strategists, there are thinkers, you know. So, you know, everybody plays a key role.
Yeah.
Because I don't know much about politics, but, you know, I know about strategy, you know. So, but I have to know about politics. So, you know, we get schooled in that, and then those who are pure politicians get schooled in some.
Yeah.
So it works as a brilliant cabinet, you know, it works very well. And of course, Mr. Governor is a fantastic leader. You know, he listens.
Right.
Yeah.
And he makes provisions. He will not say he knows everything. So he's been through crash courses on biosecurity and COVID.
Wow.
And even now, I don't need to talk much about COVID anymore. Mr. Governor knows it all.
Oh,
So
yeah.
my job's done.
Yes.
So is COVID over?
COVID?
I think so.
Now, there's a better way to ask that question.
Which
is the COVID crisis over?
Okay.
So the COVID crisis is over, and it should be over after 4 waves. I mean, if we haven't learned how to manage COVID after 4 waves, then
But we all haven't been vaccinated, though.
Who has?
We need to increase
I
vaccination.
have been vaccinated. I even have a
We've all
booster.
been.
But
But
there are a lot of people out there that haven't been vaccinated.
You've been vaccinated naturally. You had it 4 times.
Oh, okay. Okay, so that is another form of
It's built in
what do you call it,
that
herd immunity,
Yes.
where more people have gotten it along the way, and
Yeah, it doesn't
they're safe.
protect
What should we
you ultimately, but if you've had COVID 2 or 3 times, you know, and each wave goes through Lagos like wildfire, you know, and it's caused by different variants. So with each wave, we've seen, unless the variant is particularly aggressive, we've seen that we've been able to manage it easier. So the vaccines plus the natural infections is what's helping us manage the situation.
Let me have the final
Yes,
question.
so, you know, Lagos is working really fine. We see all of these policies, we see the strategies, we see it.
Are we
live
working
here.
fine?
Yeah, I think
Well,
we are
thank you
compared
very
to
much.
many
That's
other
right.
states. And my worry is everybody wants to come to Lagos.
Hmm.
So how do you liaise and, you know, have conversations and discussions with governors of other states to pick up and also do better so that their people will stay there?
How do you even
So that we're not-
support them?
Yeah, support them so that we're not overpopulated in Lagos. That's
Yeah,
one.
but we
And what are your future
how many of us are from Lagos?
Yeah, that's what I'm saying. Everybody wants to come to Lagos. Lagos is the new America, so to speak.
at least in
So
Nigeria.
how are you
how
doing
do you-
to support
yeah,
other
support
states
other,
as a health
governors?
commissioner?
So you're throwing me into the political arena.
Try, sir.
He says he's a strategist.
So yes, you can be the victim of your own success. You know, the better you get, the more you have to cope with. So what Lagos does is it forms an alliance with its immediate neighbors to form a buffer zone.
Okay.
Right, so the states around us, Ogun State, Oyo State, Osun State, Ekiti State, you know, we need to work with them so that when the movement of people is coming south and they get to Ibadan, for example, and say, wow, Ibadan's not bad. Why do I need to go and suffer in Lagos? You know, or they go to Lagos and they remember Ibadan. I say, oh, I'm out of here, you know, and they go back to Ibadan. So we need to distribute, you know, the migration burden across the buffer zone of Lagos. But Lagos is always reaching out to states across Nigeria to help in any way we can. We've received numerous courtesy visits. We've been to many states.
We have to wrap up, unfortunately.
We've finished the time.
We have squeezed the time. In fact, I have to thank my
You have
director.
to come back again.
Because somebody's asking me here, the Prof said, please ask the commissioner if when will we stop wearing masks in Lagos? Where will it be outlawed?
We're not wearing masks.
So please,
They've not.
please,
He's not wearing mask now.
he's not wearing masks. So please, you don't have to wear
At
masks.
least normally you will sit under his chin.
So
He's
that's
not
the
wearing
answer to you,
I have it
Auntie
on
Shola
standby, but I don't
Adeshoko.
need it.
Don't wear mask. That is all we can take on the show today. I hope you've learned a few things that we have. We're going to bring you back, sir.
No
Because
problem.
there are still more issues. There are people crying. When they go to the hospital, they send them back because they don't have police reports.
Yeah.
You see having people, their negligence, what
Yes.
prosecution
Private
of
hospital monitoring.
So there's a
Abroad
lot
to
of
monitor
things we need. So we'll bring you
private
back over for a
hospitals
second
very well.
show
Sure.
to help us discuss and tackle that.
You will be from
Have
9
a great
till
day.
11.
We'll see you tomorrow. Bye for now.
Okay.